facility, and the other individual was participating in the events. At this time, those are all the details that are available about those two individuals.
Okay, thank you. Adam Lawson.
Adam, if you're talking, I can't hear you.
Adam, it looks like you're muted. We'll move on to Hannah Smoot, and then we'll come back to you, Adam, if you can unmute then. Hannah?
Hey there, can you hear me?
Yes, we can.
Yes, I can.
Great, perfect. Well, could you tell us when those two people did pass away, and how many other people do you have that are currently waiting to get their test results back?
Unfortunately, I'm not able to provide the exact dates of death for those individuals at this time. Also, your second question around how many folks are waiting for test results. Unfortunately, we do not have a registry of all the folks who attended the events, and we don't know because people are getting tested at various testing providers across the community. We're not made aware of the individuals who have been tested by name, and we're not able to track them that closely. So we don't know how many folks are waiting for test results, but we at least know that there are people who have been tested and are waiting for results. At the event that we held on Sunday at StarMed, there were 182 individuals who were tested, and all of those individuals have received their results. And we will, of course, as we have testing events tomorrow and Friday, we'll be happy to report information about those as well.
Okay, Adam, are you able to unmute?
I can just go if you're okay with that, Pam, since it's David with WBTV and he works with us. So I had a question about how the county is working with United House of Prayer. We just received a tip that the church has encouraged members not to communicate electronically about the church in any form or fashion. Last night, Deputy Director, you just mentioned that the church is not interested in hosting a testing site on its property, and so y'all have found a different location for that. Do you have any concerns that the church doesn't want its members to get tested or is not cooperating fully with the efforts the county is taking?
Yeah, so I guess I'll just reiterate to you, David, that we 100% encourage anyone who participated in these events to go get tested, to monitor themselves for symptoms, and in no way should folks not do that. So I just want to make sure that folks in our community know that, that's really critically important, regardless of what anyone might say to you or suggest. I'm not personally, I don't have more insights into the information that you received via the tip. But certainly we want folks to be tested and to, of course, monitor themselves for symptoms. I've been in contact with the pastor of the church, the apostle who leads the church here in Mecklenburg County. We have been in contact on a daily basis. They, as I said last night, and I'll reiterate, they're not interested in hosting a testing site on at their property, but I do know they have communicated to the members and encouraged them to be tested. And that's all I can say about that.
All right, Robin Kennedy.
Hi, Dr. Washington. Along the lines of the church cooperation, are you concerned about them hosting future church services? And have they made any indication to you all that they will or they won't?
Yeah, so certainly I'm concerned about any future services, at least in the near future. Part of the concern is that we are just unaware of how many individuals were potentially exposed or may currently be infectious, either with or without symptoms. And so we're continuing to monitor the situation very closely. So I have personally advised the church not to host any other gatherings for at least 14 days. I have been in contact with the church about that twice now, and so I think we are discouraging any gatherings at the church at this time.
Vanessa?
Hi, can you hear me?
Yes, we can.
Perfect. Okay, I have two questions. First, I just wanted to clarify the clusters that were reported at the independent living facility. So was this a situation where one person was a participant in the events at the church, brought it back to the facility, and these 5 other cases stemmed from that? Or how did that work? And then my second question is, we heard the governor speaking today about the concerns with getting people to comply with some of the safety protocols like masking and social distancing. Are you aware of what specifically went wrong with this particular gathering? Was it just a very large gathering? Was it a large gathering with no masks, with no social distancing? Exactly what did that look like?
Yeah. So to answer your first question, based on our investigations, at least 4 of the residents of the facilities participate actively in the events. Secondly, one of the reasons why we discourage any large gatherings is because they are difficult to manage. And I believe I spoke to this last night related to some of the other types of establishments in our community. When a lot of people get together, it's very difficult to ensure that people are actually maintaining the 6 feet distance. It's important to not just wear the mask, but to also keep the distance. We shouldn't be making physical contact with one another, with surfaces, et cetera. There should be constant hand hygiene. And if you have a lot of people coming together over several days, it is very high risk for those kinds of, for the virus to spread if someone's there. We are aware of some individuals who were infectious while they were there. And so because of that, certainly contact with individuals either inside, particularly inside, where the risk of spread is much greater, it can result in the virus spreading pretty quickly.
Drew?
Thank you for taking my question. Dr. Washington, are you confident that the church will listen to your request not to host any events? And then at what point does or can CMPD or another enforcement agency get involved?
At this point, I have just requested that the church follow our guidance, and I'm hopeful that they will certainly follow that guidance. It is, I think, well-informed guidance, given what we know about how the virus has spread among their constituents of the church, the members of the church. So I think certainly I'm hopeful that they will comply. And if they don't comply and we feel like there's more risk associated with it, we will certainly continue to have conversations with them and consider all options available.
Are there any more questions?
Let me just, this is David Hodges with WBTV, and Dr. Washington, let me just follow up on that. I know this isn't your area of expertise, but to whatever degree you feel comfortable answering, there's definitely limitations to what the county or CMPD can enforce at a house of worship or religious gathering. I mean, does that come into play here with the size of these events, their cooperation, and things of that nature?
Of course. I mean, I think we all know that there are limitations in terms of what happens with places of worship and regulations. So certainly that's a challenge. But we are working aggressively with all of our churches in the community, all of our houses of worship, to ensure that they have all the information they need to be able to, if they do gather, to do so safely. We've provided educational materials and we'll continue to do so. We are making our COVID ambassadors available to any place of worship to help walk through what protocols would look like to safely have folks in their buildings. And so we continue to be available and as a resource to all of our places of houses of worship in this community so that people can safely engage in and worship and practice.
I have another question. Do you have any idea the total number of people who were involved in these events over the course?
I do not have a definitive count. I do know that there were hundreds. I can say confidently from videos that we've seen, there were at least hundreds of people. My understanding is that there were probably more than 1,000 people involved over the course of that week, from the 4th to the 11th. Again, I don't have a registry or a log of the individuals that were in attendance, so I'm not able to give a definitive count.
I have one more question, Dr. Washington. This is Robin with Fox 46. Just wanted to clarify with the deaths. One of them, I believe you said was tied with one of those congregate living facilities. Was that one a person who directly attended the event?
Unfortunately, I don't have that information available right this minute, but we will try to have that available at future follow-up.
Okay, and you don't have any other information about any other congregate living facilities, just that one that you named, correct?
Correct. That's the only facility that we currently have evidence that there would be linked to the event that occurred.
You might have mentioned this earlier and I just didn't hear it, but do you have new numbers on how many people are quarantining in connection with this at this point?
Yeah, so we've been 94 close contacts of the individuals, of the 68 individuals who we have laboratory confirmed cases, we've attempted contact for all 94 of those individuals and given those individuals quarantine instructions. For those who we were not able to successfully contact because they just either didn't answer the phone or we haven't gotten in touch with, they will receive a letter in the mail if we have a mailing address as well. And we'll continue to call, of course, according to our standard processes.
Are there any more questions? Well, if not, thank you so much. Dr. Washington, we appreciate your time. We thank you, media, as well, for attending. As was already stated, Public Health advises anyone who attended the events at the church between October 4th and October 11th, or has been in contact with someone who attended those events, to get tested for COVID-19. Thank you.
Thank you.